I remember last year Boris Johnson saying, you can have your Christmas, as if we should be grateful, as if they own everything. It's all been the wrong way round. Have a little think about this. The government have spent nearly £400 billion dealing with coronavirus. We have, in the course of all of this, damaged the education of millions of children, left millions of elderly, lonely people out there in the country in a state of some depression, closed down hundreds of thousands of small businesses who were simply in the wrong sector and have gone bust. And we did it all because we were told this could be a repeat of the 1918 Spanish flu. This could be an event that would kill vast numbers of people. Now, we've seen again and again estimates of how bad the crisis could be that have nearly always been massively over-exaggerated. But this has really made me sit up and think. I've not seen it commented on, written about anywhere else, but it's this. A Freedom of Information request was put in to the Office of National Statistics. It simply asked this question. Please can you advise on deaths purely from COVID with no other underlying causes? And the number is 17,371. Now, I know that's 17,000 human beings, and to their friends, their families, their partners, each one of those would have been a tragedy. But just think about that number. 700,000 people die in this country every year. We have just been through 2 years of on-off lockdown, of our rights and privileges being taken away, of perhaps many people not being diagnosed for upcoming serious diseases, and we find out that only 17,000 people have died with or of COVID with no other underlying conditions. I think we need to have a proper debate about this. Well, I'm very pleased to say that joining me to discuss all of this is Professor Carol Sikora, oncologist of 50 years and the ex-director of the World Health Organization's Cancer Programme. Carol, good evening.
Good evening, Nigel.
I have to say, I'm blown away by this figure. I mean, I'm absolutely astonished that it's just 17,000 people who had no other underlying medical conditions. Am I getting overexcited about this number?
I think maybe a little bit. Let me explain. It's actually very difficult to know why people actually die at the time they die from something. So with young people, it's very clear. If you're 25 and you have a road accident or you get COVID and you die, then it's ascribable to these incidents. When you're 70, most people have got a variety of illnesses, heart disease, lung disease, liver failure, all sorts of things. And when you're 90, you have even more. And that's the problem. Because the average age of death, and this is critical for COVID, was 82.5 last year. 82.5 is beyond the normal life expectancy. So obviously people at 82 are going to have lots of what we call multiple comorbidities, lots of things wrong with them. And so it's very difficult to know, did COVID kill them? Did COVID push them over the cliff into death, very sadly? Or did they die of a heart attack or kidney failure? And that's the problem. The definition in the NHS of a COVID death is someone that tests positive for COVID on their NHS number in the last 28 days. So quite a lot of people have done that, even though they're walking the streets now. They're not dead, but they were tested at some point. If they'd gone into hospital with kidney failure and died, they would have been a COVID death. That's the problem. It's a statistical quirk in how we analyse it. It has been used by the politicians, of course.
I understand that. But, the other figure that you've just quoted, the average age of death last year was over 82 years of age, which is actually above, as you quite rightly say, the average life expectancy. Has this all been worth it? I mean, and I'm not going to ask you about the civil liberties questions, but medically, we now have 6 million people waiting for procedures on the National Health Service. We have backlogs in cancer, your speciality area, diabetes screening, and many other medical areas. Has half closing down the country for 2 years actually been worth it? When you look at the numbers of those, albeit you've questioned them, but the numbers of those who've died, without any other underlying conditions, and the average age of death, has it actually, in medical terms, has the lockdown, has the clearing out of the hospitals, has it actually been worth it? Or will we look back at this and regret it terribly?
I think we're going to regret it. When we look back, and you can only do it with a retrospectoscope, you've got to look back and see what happens. In my specialty, cancer, you'll look back and you'll see probably extra 50,000 deaths over the last 18 months from cancer you wouldn't have had. And that's the problem. The life years lost is another way of looking at things. If people are dying at the age of 82.5, on average, there are some tragic deaths in very young people with COVID. But if it's 82.5, that doesn't compare with a young woman of 40 with breast cancer, for example, that's missed her radiotherapy, missed her chemotherapy, and subsequently got recurrent disease and died. So it's a balance. And, in a normal circumstance, we've got this organization called NICE that look at the cost effectiveness of different comparable treatments and try to come to some semblance of order with them in a logical way. They could look at this and say, look, spending all the money on COVID for certain types of patient wasn't really worth it. Better to spend it on cancer, on heart attacks, on strokes, and so on. And that's the problem, trying to analyse the whole thing. There's been very little leadership in pointing the way forward for doctors. We're all specialists now. So there's a kidney doctor, there's a cardiologist that does hearts, there's me that does cancer. We're all vying for resources within the system. And of course, COVID comes along and takes them all away, just as they've taken all our tax away. I mean, the billions of pounds that we've spent on COVID has been taken away from other things, education, roads, railways, all sorts of things. So I think we've got a problem. We've got to get out of this, analyse it properly, and then go forward, not doing this again.
Carol Segura, there's a lot to think about there. We'll be analysing this, I've no doubt, for many, many years to come. Thank you for joining me this evening.